Hello, I'm Dr. Natalie Tobert and I'm delighted to be offering this course in association with the Scientific and Medical Network. The course is entitled Clash of Beliefs and we'll be looking at the mismatch of beliefs around health and the body within medicine and healthcare. Why do we think beliefs are important? Well, I've done original research in India and in Africa, and it was while I was in Sudan in Africa walking around a village of small houses that I terrified a young boy. He caught sight of me unexpectedly and ran back to his mother shouting, "Mummy, Mummy, there's a lady with no skin on." So this was his belief according to the evidence in front of him, according to his world. So that was a harmless belief, but there can be beliefs that are more damaging about reality and the state of existence. For example, an African woman walked into accident and emergency at a hospital with her relatives, and she's absolutely distraught because she said there were spirits and ghosts in her house and they were terrifying her. The doctor on duty assumed that she was delusional and sent her back home with her relatives with devastating consequences. They found her dead the next morning. So in these cases, belief is critical to know and to be able to reflect on our own beliefs. Now, sometimes people say to me, "I've got no beliefs, I've got no belief system." And it's usually people who are living with their peers and with the people around them, and they all have the same kinds of belief. And so usually you'll find on reflection that many people have different ways of thinking. When I ran a group inviting psychiatrists and religious leaders into a room together over lunch to discuss how they interpreted the symptoms of mental health, one of the community leaders came up to me and she said, "Natalie, thank you very much for showing us how to access the mental health care system here. But we'd be really grateful if you could train staff in cultural ways of thinking about reality. That would be really helpful for us." So the course that I'm offering, it's covering the body and the self and looking at different ways of understanding and interpreting symptoms. We'll look at the value of women in our society, which is so diverse. And mental health is such a contested area. We'll look at people's beliefs around the symptoms, about spiritual awakening and altered states of consciousness. And we'll also look at beliefs about death and beyond, out-of-body experiences, near-death experiences and reincarnation. Finally, we'll look at cultural U-turns and the changing paradigms. What do I mean by cultural U-turns? It's when a government creates laws according to its beliefs about the behaviour and morals of society and then realises some 10 or 20 or 50 years later that it was in error, and it apologises to the people concerned. And I feel we're coming up to a cultural U-turn with regard to mental health now. So those are the kind of sessions that we'll be covering. Who would benefit? People in healthcare, frontline practitioners, ambulance staff, police, housing, nursing and midwives. People like us would benefit from reflecting on beliefs about different cultures and different notions of reality and what it means to be human. Now, the course has limited access. It's on in the new year. If you would like to register, you can join by looking at the Scientific and Medical Network's web page and log on to events. and I look forward to seeing you there. Thank you very much.